All right, basic dispensing in theory 352, and we'll be starting with drug storage and stability. It is important that you store your medicines and drugs very well, properly, to avoid degradation, or in simple language, to avoid spoilage. And one of the critical factors that is important for storage or for stability of medicine is temperature. Okay, so that's why for specific drugs, we always have temperature recommendation for specific drugs. So when they say freeze, freeze means below -5 degrees Celsius. That's what freezing means. When they say refrigerate, it means between 2 to 8 degrees Celsius. And you must ensure that you do not freeze the medicine or you do not freeze the substance. Then for air conditioning is below 25 degrees Celsius. That's for air conditioning. Then for room temperature must be below 30 degrees Celsius. So it's important for you to know the storage conditions, the temperature storage conditions of the drug, and store them appropriately. So for a drugstore, if you are going to choose a drugstore must be a room that you can lock, and the temperature must be below 25 degrees Celsius with 24-hour air conditioning. Then you must provide vaccine refrigerator in a drugstore for your vaccines and antivenom, because clearly all these drugs are thermolabile. And by thermolabile, we mean that they can be destroyed by heat. So apart from the refrigerator for vaccines, you should also have refrigerator for other pharmaceutical products too, that may be destroyed by heat. Then in a drugstore must also have adequate shelf. You must have enough shelves where your drugs can be stored. So what are the categories of drugs that we have? We have thermolabile drugs that must be stored in the refrigerator. Then your drug can be oral form, solid, liquid, injectable, topical, infusion, inhalation. Then we also have non-drug items in the pharmaceutical store, like your syringes, consumables generally. So drugs in the central pharmacy are displayed or kept in ways that facilitate easy dispensing. So it's either you store your drug alphabetically, or you store them based on the therapeutic class, or you store them based on the dosage form. Oral suspension on one side, oral drug on one side, solid dosage form on one side, liquid dosage form on another side. Okay. So for stock control, most pharmaceutical stores, they control their stock either annually, biannual, meaning twice in a year, monthly, weekly, or real-time inventory using some computer softwares. Then also, apart from storing alphabetically based on therapeutic class, based on dosage form, we can also use quality standards. And under these quality standards, we have, based on the expiry date of the drug, we have some terms. FIFO. I believe you know this. This means that first expiry, first out. That's for FIFO. So you arrange the drugs that are soon to expire in front and keep those ones that we still have long expiration dates at the back. That's FIFO, first expiry, first out. Then FIFO, first in, first out. The drugs that you purchase first, you keep them in front. If you do not have issues with expiry dates, you keep those drugs in front. Then the ones you purchase last, you keep them at the back. Because the longer the period of purchase, the higher the possibility that your the package will get rough. So that's why you must sell those ones first. What am I saying? For FIFO, if you have two different batches of paracetamol, you bought one last year, October, and you bought one this January, and they both have the same expiry date. The one you bought first, you must sell those ones first before the one you now bought later. That's FIFO. Then we have LIFO or LIFO, last in, first out. That's what that means. So when it comes to this, they will likely be asking you the meaning of these things: FIFO, FEFO, LIFO, and all. So for drug stability, stability is the ability of a pharmaceutical dosage form to maintain its physical, chemical, therapeutic, microbial properties during storage and usage. So we have some terms like the expiry date. The expiry date is the date on that your package that is expressed as month and year. And beyond this date, it is assumed that the drug is no longer safe for use. That's the expiry date. So if a drug has June 2024, it is assumed that the drug is no longer safe for use after the last day of June. That's the assumption. Shelf life. Shelf life is the period of time between the manufacturing date and the expiry date. So if the drug was manufactured January 2024 and is going to expire June 2024, that means that drug has a shelf life of 6 months. So shelf life is the period between the expiry date, the manufacturing date, and the expiry date. And from the name, shelf life, it just means that the period of time the drug can spend on the shelf, after which you have to remove it and discard appropriately. So what are the factors that affect the stability of medicines, of drugs? We have temperature. High temperature can accelerate degradation reactions. And degradation, I told you, it just literally means spoilage. High temperature can accelerate oxidation, reduction, hydrolysis. Then also pH. Most drugs are stable between the pH of 4 to 8. So if the pH changes, then it may affect the drug. And that's why some companies, not some companies, that's why buffers are added to most drugs. The essence of buffer as a pharmaceutical excipient is to maintain the pH of the drug. That's the essence of buffer. And we have a lot: phosphate buffer, acetate buffer. Okay. Another thing that can also break down your drug is moisture. Okay. So moisture, because it can also catalyze a lot of reactions. Then for another factor is also light. Light can also break down your drug. And that's why you can employ opaque packaging. Example of opaque packaging is your amber bottle. And some people also, you can also use foil, aluminum to package your drug to prevent from light degradation. Oxygen also is a factor that can affect your drug and cause spoilage. So what are the measures you take against oxygen? You ensure you store your drug in a tight closure, the what you call cover. The closure must be tight, okay? Then antioxidants too are used. Now, so what are the type of degradation processes that your drug can undergo? Number one, we have hydrolysis. Let me quickly just say this. If you are not hearing me very well, you may we enjoy Zoom better if you are not using your video. But if you can hear me very well, you can also keep using your video. That's not a problem. Okay. So hydrolysis is one of the degradation process your drug can undergo. And hydro means water. So it just means the degradation that is caused by water. Then oxidation too. Your drug can undergo oxidation if the pH changes, if it's exposed to light and all of that. Then photodegradation, when your drug is exposed, some drugs, not all drugs, when some drugs are exposed to light, they can also get spoiled. So from there, let's go to stability of individual preparations. Now, there are some preparations that what I want to talk about is post-opening stability. There are some preparations when you open them, the degradation starts. When you open them, because you have opened them, their expiry date begins to count. So you don't have to look at the expiry date on the pack. Once you open them, their expiry date begins to count. For instance, eye drops, after 1 month of opening, you must discard it. That's for eye drops. After 1 month of opening, you must discard your eye drop. So if you see an eye drop and the expiry date on it is 2030, but once you try to open and you see that they've opened that eye drop, forget it, don't use it. Okay? There was a time in the school, in the college, when I was still there, a true student came to meet me. He said she has issues with her eyes and that she has been using eye drops, but it's getting worse. I now asked her, the eye drop you are using, when did you buy it? She said last year. She used it last year, but that she didn't use much. I said last year, and you are now using it again this year. It's very wrong. It will make the eye worse. So once you open your eye drops, after 1 month, discard it immediately. Don't even keep it. Don't say that it has not expired. Don't keep it, because it's a sterile product and it's assumed that it's expired after 1 month. In fact, some labelings or some packaging will say 3 weeks. Okay. Then antibiotic suspensions and syrups, particularly those ones that are powder and you have to add water. After 1 week at room temperature, throw it away. But if you have stored it in the refrigerator every day, it can still stay for 2 weeks. So your powder for reconstitution, those antibiotics powder that you buy, once you add water, if you are not keeping in the fridge, you must discard after 1 week. But if you keep in the fridge, it can still stay for 2 weeks. Then injections in ampoules. Ampoules are the ones that you have to break. You know ampoules, now those small, tiny ones that are for single use. They are different from vials. Vials, we have rubber ball that you can insert your needle to withdraw the contents. So vials are for multiple use, but ampoules, you break the ampoule. So once you break the ampoule, you should use immediately. Okay. Then actually, even for vials, what is inside the textbook, the theory, is that you should use within 24 hours. Okay, but in the hospital, they still use it beyond 24 hours. Okay. Now, nebulizer solution. There's something we call nebulizer, nebus, salbutamol. That's your beta agonist for asthma. It comes as inhaler, it comes as tablet, it comes as syrup, it comes as nebules. The nebules, you administer it using a mask. You mask your patient, then your patient will inhale the nebules. Okay. Now, for these nebules, once you open, you should discard after 1 month. Insulin injection too, and once you start using it, once you puncture the injection, at least you should use within 28 days. Then even your liquid syrups and suspensions too. After 1 month of opening, it is expected that you should discard. But some people still use beyond that period anyway. Not even now that the economic situation is not very friendly. Then for tablet and capsules, once you remove from the sachet, once you remove from the blister, the expiry changes. So for those of you that get counting drugs from the hospital or from the pharmacy, you must complete it. You must follow the dosage regimen and complete it, because the longer you keep it, the shorter the expiration date. So once you remove a tablet or a drug from the package, then it is no longer, it will no longer maintain that stability. All right. So that's it. And I wanted to say something on storage too. It is not advisable to keep your drugs in the vehicle. The reason is because when you park your vehicle, you park under the sun, the temperature may be too much for the drug and it may degrade your drug. Okay. All right. So this is that about stability of drugs. Then hold on. Please, if you have questions, you can ask me. Hold on. I want to also take suppositories and pessaries. The question. Okay, so suppositories, they are dosage forms. They can be solid or semi-solid, depending on the preparation. And they are intended for insertion into body cavities. And in these body cavities, they melt, they soften, or dissolve, and they can exert either local effect or systemic effect. If we say something is exerting local effect, I believe you know what it means. And if we say something is exerting systemic effect, I believe you know what it means. Anything that is exerting local effect will not be absorbed considerably into the systemic circulation, which is into the blood. Then whatever has systemic effect has to get into the systemic circulation, which is the blood. So pessaries are a type of suppositories. They are also examples of suppositories, but they are intended for insertion into the vagina. So they are vaginal suppository. And they can also exert local effect or systemic effect. When you are treating thrush, vaginal candidiasis, which is a whitish yeast-like infection that is whitish in color anyway. If you are treating it in pregnancy, you must use pessary and not oral antifungal. If you use oral antifungal, they are contraindicated in pregnancy. So you must use the pessary. And the pessary does not get absorbed into the body system. The pessary work just locally. The pessary will just kill the yeast, the fungi in the vaginal region. That's all it does. It does not get absorbed into the systemic circulation. So there are other types apart from pessaries. We have rectal suppositories, and they can be in torpedo shape. What happened? They can be in torpedo shape. For an adult, is about 2 grams. For children, is about 1 gram. You don't need the details of this grammage. They hardly ask. Then vaginal suppositories are called pessaries. Then they are oviform in shape. They are like ovoid in shape. Then we have urethral suppositories called bougies. Bougies. You need to know the other name because I think they've asked one. So urethral suppositories are bougies. Then we have nasal suppositories, which you can also call nasal bougies or bouginaria. We have suppositories too that can be inserted into the air. That is urinaria. Urinaria. So what are the advantages of suppositories? Suppositories can exert local effect. Take, for instance, in the case of your hemorrhoids, where the veins are swollen, the blood vessels in the anal canal are swollen, and you apply anusol, you use anusol suppository. It can exert local effect on the rectal mucosa. Then suppositories are also used to promote bowel evacuation. If somebody is going for endoscopy, if they are going to insert a scope into the person's rectum to check the gastrointestinal tract, they will first give the patient maybe a week before or some days before bisacodil suppository to go and use so that the person can purge, and the rectal way can be clean. Okay. Then they're also suitable for unconscious patients, those that have difficulty swallowing, and they are suitable for children too because they may sometimes reject to swallow drugs. And another advantage of suppository is that suppository can bypass first pass effect. Who can tell us what first pass effect is? Anybody who can tell us what first pass effect is? Sharp, 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 sharp.
Means that it will not pass through disintegration stuff to just absorb directly.
No, no.
Is when the liver acts on drug.
Yeah, that's first pass. So first pass is when before your drug gets into the systemic circulation, the liver breaks it down first. That's first pass effect. So suppositories, to the advantage is that your drug will bypass first pass metabolism before systemic absorption. So please take note, first pass metabolism is when the liver breaks down the drug before it is absorbed into the systemic circulation. I apologize. You see that the space at which I'm talking is very fast. And that's because there is no time again. So I want to ensure I cover all the grounds I want to cover before you now go into the exam hall. Obviously, you will get help in the exam hall, but it still should not stop us from doing tutorials. Even when I was around, when I know that 100% we are going into that exam hall to help, I still do all night tutorial, like the students are not going to get any help. And it has its own advantage too. So that's the essence of this. I want to cover all the grounds we need to cover. Then we now commit you into the hands of God and the hands of your capable lecturers who will now do the job to again in the exam hall. Okay, so what are the disadvantages of suppositories? We have one, patient acceptability issues. Some patients can find it very funny that they want to insert something into their anus. Okay. You know, in fact, some people may not be able to do it. Then if you now say, imagine, okay, if I'm a father now and Lovett is my child, and I say, Lovett, come and me inside this suppository. Lovett will be like, are you whining me? You know, because it's embarrassing, kind of. And even as a father, I may not want to open my yash and ask her to help me insert something because it's embarrassing. Okay. So patient acceptability is an issue. Then for someone that has diarrhea, there is no point using suppository because you are inserting it, the person is going to shit it immediately. Then some drugs too are irritating, so you may not be able to give them via the rectum. Then there may also be incomplete absorption due to bowel evacuation. Suppositories are prepared with base, and that's why I told you they can either be semi-solid or solid. Some suppositories, not all, are prepared with base. And when I taught you ointment, I said when they mention base has the consistency of Vaseline. A lot of you know Vaseline now. So when we say base is something of that nature. Okay. Then while some suppositories are compressed, like you make a tablet, you don't use base, you just compress them. Example are some of your vaginal suppositories, the pessaries. So, but the base you use in the manufacture in making suppositories must have the following ideal characteristics. Number one, it must melt or dissolve at body temperature. Okay, once you insert it, it must melt or dissolve inside the body fluid. It must be non-toxic and non-irritant. It must be compatible with medicaments. It must release the medicament readily. It must be easily molded and removed. It must be suitable to eating above melting point. It must be easy to handle, stable on storage. If you go to ointment too, you will see that all these properties, particularly the ones I highlight, They are also under the properties of ideal ointment bases. Okay, so it's just like a repetition. So what are the types of bases that we use in making suppositories? Majorly, there are two types. We have the fatty bases and we have the water-soluble or water-miscible bases. For the fatty bases, one, we have theobroma oil, cocoa butter. The botanical name of cocoa is Theobroma cacao. So if we say Theobroma oil, we are referring to cocoa butter. It melts at 30 to 36 degrees Celsius. And what is the temperature of the normal human body? The normal human body temperature? Anybody? What's the normal human body temperature? Yes, 37.5. So you will see that this cocoa butter is going to melt when it gets into the body because the melting point is 30 to 36 degrees Celsius. It is non-irritating and it is miscible with many ingredients. But the disadvantage is just that it has issues with polymorphism. It can change, it has issues with polymorphism, meaning that it can change its nature from crystal to amorphous and all that. Then it adheres to the mold, and there are also some other issues, and that's why we now have synthetic hard fat. And this is synthetic hard fat. They are just made to overcome the problems of cocoa butter, like the polymorphism and all. So, but it also has its own issues too. But an important example you must know is white spore. White, white, white. How do we pronounce this one now? Maybe white wheat tips or something. So you must know this because I think I've seen a question on this before as a suppository base under synthetic hard fat. Then we now have water soluble and water miscible ones. The example is glycerogelatin, one. Then we have macrogause. Another name for macrogause is polyethylene glycol. You see, the macrogause or polyethylene glycols, they have molecular weight. No molecular weight from basic chemistry now. The higher the molecular weight, it's just like in your hydrocarbons in chemistry too. If your hydrocarbon has low molecular weight, it will probably be gas. Higher, it will be liquid. Then the highest, it will be solid. The same thing for polyethylene glycol. You see that the one with molecular weight of 300, 400, 600, they are liquid. Then the one with molecular weight of 600 to 1000, they are semi-solid. The one with molecular weight greater than 1000 are solid. So a quick recap, we have fat base for suppository. Example one is cocoa butter. Example two, they are the synthetic fat, like the wheat tip saw, wheat tips, this way. Then we have water soluble. The example is glycerogelatin and polyethylene glycols, or otherwise known as macrogause. That's all you need to know. Forget all this PG. You just need to know the very important things. And that's why I've summarized this note, all these notes. So how do you prepare your suppositories? One, you can use hand molding. You can use your hand to mold. You just triturate and mold with your hand. Another one is compression molding. That's another method that you can use. Then we can also use pour molding. To pour something. When you use pour molding, you will need molds, suppository molds of different type. And before you do your pour molding, you must lubricate the mold so that it will be easy for you to remove your suppository when it forms. Then you can prepare using the automatic molding machines in the industry. And also, how do you package your suppository? They are usually packaged using aluminum, paper, or plastic. If you check this one, the packaging here is plastic. For this suppository here, packaging there is plastic. So usually we use tin, aluminum, paper, plastic. And another thing you must know about storage, if you have prepared your suppository with cocoa butter and glycerinated gelatin, you must put that suppository in the refrigerator. But if you prepare your suppository with polyethylene glycol, you don't need to store in the refrigerator. Let me repeat that. If you have prepared your suppository with cocoa butter and glycerinated gelatin, you need to store in a refrigerator. But if you are prepared with polyethylene glycol, you don't need to store in the refrigerator. You will see that mycotin is a suppository. Mycotin pessary is a suppository, but they don't store it in the refrigerator. That's because of the method of preparation and the things that have been used. You don't need to store it in the refrigerator. Okay, so this brings us to the end of what we have today. We have taken 1 year in BDT. I want to take lectures in BDT and we finish it before we now take other years. So that's the plan. We still have like 2 months. We will be able to finish all these things. Okay, any question? Any question from anyone? Quickly, let's take questions. The mode I'm in now is para mode, no slack. I don't want to dish out everything fast. No time. Okay, so any question? Okay, if there are no questions, I'll alert you when we are going to meet next. But when we meet next, we wrap up BDT 352 that same day, immediately. Then we can now go to 351 and other ones. All right, enjoy the rest of your day.
Thank you, sir.